Hello everyone, good night and welcome to my presentation. First of all, let me thank you all for coming here today. Let me introduce myself. My name is Devi Sabrina Putri. I'm from Serang, Banten, and today uh, I will presentation about effect of a multi-component cognitive stimulation program on cognitive function improvement among elderly women. Okay. Um, Firstly, our presentation about the abstract or the background of, from this poster. Okay, in Korea, the age distribution of the elderly population increased as the elderly population increased and the prevalence of dementia increased rapidly around 80 years. Ledger et al. Recommended changing the middle old age from 75 to 80 years in a recent study. On age depends of risk factors for cognitive decline. Therefore, it is necessary to verify that the CISP for the elderly has the same effect based on the middle old and old age inflection point of 80. This study seeks to verify whether a multi-component CSP or MCP is effective in improving cognitive function among elderly people with normal levels of cognitive function. The result this study can be used for planning community work project needed to prevent the progression of mild cognitive impairment and dementia in elderly people with cognitive function decline as age increase. The specific study objectives are as follows. To verify the effects of the MCP on the improvement of cognitive function among elderly people, and secondly, to determine differences in the effect of the MCP on cognitive function among the under 80 and above age groups, and thirdly, to define the interactions between cognitive function enhancement through the MCP and age. Okay. So we are moved to the method. Okay. This study design a one group pre-test post-test design was used in the study. Setting and sample, the participants were elderly people aged 65 years or older recruit from 4 senior citizen centers in Incheon City, Gyeong Country, South Korea. MCP intervention. The MCP was designed to improve the general cognitive and social functions based on the clinical guidelines for occupational therapists. The program focused on physical activities that enhance memory, attention, and visuospatial or executive ability. Okay. Additionally, the program includes some activities aiming to improve abstractive ability and orientation enhancement. Okay, the program was conducted in 8 sessions across 10 weeks from July to December 20 and 18. The first session was conducted for 1 hour using rather simple tasks, and with each successive session and difficulty of the task increased, such that participants had to perform multiple functions at a time or memorize more words. Okay, so we move to the result. Result for visuospatial or executive ability. The authors observed no difference between age group before the programs. However, after the programs, the score of the under 80 group was significantly higher than of the 80 and above group above group. Finally, a two-way analysis of variance was conducted to verify whether there was an interaction between program effect and age. It was found that the interaction between program effect and age was significant only for visual-spatial or executive ability. Okay, and the list of all senior citizen centers in the city was reviewed, and senior citizen centers with similar environment were selected first. Then, for senior citizen centers with the most similar conditions were selected after checking the nearby environment, the number of the registered elderly and users. Okay, prior implementation of the program and other program implementation plans during the study. The KMOCA was administered twice, and data were collected by the reach a week before the program or pre-test, and a week after the program or post-test. About 20 minutes were allowed to each individual before each test. The research instruction participants on how to complete the KMOCA and how their data will be analyzed. And the conclusion. Okay, in a conclusion, the MCP for healthy individuals with normal cognitive function seemed to be effective for improving overall cognitive function. This study also found that it is necessary to consider age when developing the MCPs, and the effects of the program will differ by age group under the 80 years and 80 and above, as the intervention interact with age. For visual-spatial or executive ability in particular, the authors cannot expect to see improvement in this ability over a short period of time among individuals in the 80 and above group. In addition, this study confirmed that the effect of the MCP may differ as per which factors are emphasized in the program. The result of this study can be used to develop health promotion programs to prevent the decline of cognitive function of the elderly in the community. Okay, and in the next steps, based on the findings, the author offered the following suggestion when developing MCPs for elderly people. First, it is necessary to strengthen the focus and abstractive ability in orientation, which did not improve in our study, and other physical activities should be added. For example, aerobic exercise have a positive effect on the cognitive function and brain plasticity. Second, as said earlier, age should be considered in developing MCPs. And third, it is necessary to conduct follow-up training on a regular basis for elderly people who would take part in MCPs. And finally, to be able to identify and compare the effect of various cognitive-based intervention programs, it is necessary to avoid the use of unclear concepts and to attempt repeated research using a consistent intervention. Okay, thank you very much for your attention. And the last, thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.